Hello, everyone. Welcome to the KTAL News Now Digital Streaming Center. My name is Brittany DeFran, and today I have two very special guests with me here today. I am here joined by Dr. Jaya McSharma and our very own Lynn Vance. They're joining me here today because we're talking about some trending topics that have made headlines. Of course, it's about weight loss medication and, how they've just made headlines recently, their impact on health, but also, the topic of how it also impacts individuals and patients who are diabetic. So we are going to get into all those things and into some of your questions. So I am just so happy to have you guys here today. How are you doing today?
How are you doing?
Well, I'm just enjoying you watching yourself on the live stream.
I'm like, look, Lynn, we're on TV.
We're here. We are
Can't
here.
Stop looking.
We're live.
We are live. It's like I don't know how a camera works. Country comes to town.
Yeah, no, we're doing great.
Yeah.
We were talking a little bit before we started about our experiences, so I am excited to share mine with you guys a little later. But I know that you guys are here for the expert, Dr. McSharma.
Expert? Sure, I'm a doctor. Let's say that. But yeah, do you want me to go ahead and
Yeah, go ahead. We can jump right in. Tell us a little bit about your background, about your business. She has a business called Shed It. So she's an expert in this topic, well-versed in the topic of weight loss and how these medications kind of help or impact that. So go ahead, jump right in.
Yeah, so my name is Dr. Jaya McSharma. I am a medical doctor. I went to school here in Shreveport. That's actually what brought me to Shreveport from the bustling metropolis of Alexandria, Louisiana. And let's see, I graduated in 2006 from the LSU School of Medicine, did my family residency training, and worked as a hospital doctor or hospitalist for 12 years. And then COVID made me want to change my life.
Do something
in
different.
A positive way. So yes, very luckily, a colleague of mine and his wife wanted to open a weight loss clinic, and they needed a medical director. So I jumped on board, and I've been the medical director of Shed It on Shed Road since May of last year. I think we're coming up on our 1-year anniversary. Yeah, so that's what I do now.
That's so fun, and I feel like interesting perspective that you bring, that COVID really just changed your perspective on what you really wanted to do. That's altered you to where you are now, and to what you've learned so far, especially about the topic of weight loss and these weight loss medications. Could you tell us maybe what you've learned along the way in opening your business and just a little bit about these weight loss medications?
Yeah, absolutely. So I think I am able to have a unique perspective because I did work as a hospitalist for 12 years, which means like if you came to the ER and you were sick enough to be admitted, I would be the doctor taking care of you until you were discharged. So we saw the sickest of the sick, especially during COVID, but many complications of diabetes and for people being overweight or having chronic obesity. So then shifting from like very intense medicine to outpatient medicine where I'm treating people for weight management, I think I have a unique perspective again, just because I'm able to know exactly what it is they're changing about their lives, even when they may not, because I've seen all the complications, the kidney failures, the dialysis patients, the amputations, the strokes, the heart attacks. All of these are complications of one disease, and that's diabetes. So when I'm able to help someone with diabetes or with obesity improve their weight, I know exactly what future they're avoiding. And so I think that's especially helpful to have that knowledge, because it's like, unless you are friends with or love someone with diabetes and may have seen some of that, you don't even know how much your life is improving when you're able to get healthier. And so for people who are pre-diabetic, which I was, borderline diabetic because it runs in my family and I am overweight, I was able to take the medicine myself and prevent myself from getting diabetes, which we were chatting about earlier.
That's what's incredible to me about it was back when I was diagnosed pre-diabetic, I went on to become diabetic because there weren't these kind of drugs. Exactly, and that's what I was telling Dr. McSharma earlier, like, if those would have been around then, maybe I never would have made it.
I know.
To that point.
And but I'm glad that you're here when we have them, because it can still significantly like alter the path of someone's life. But I do think we're only seeing the beginning of what's going to happen. I mean, what if in 20 years there's no diabetes? I mean, I have goosebumps. Would that be insane? these are the things that are going to be possible as we explore this genre of drugs.
Yeah. And disclosures, I was telling the doctor earlier, a couple of years ago, my A1C was up to 11. Tell them that's high.
It's high. It is high. I mean, working in the hospital, I've still seen higher, but no, it's not good.
Yeah. And so now it's a 6.8, and the goal for me is 6.
That's awesome.
So
that is awesome.
Yeah, these I'm on Manjaro right now, and it's really made a difference.
Oh, yeah.
It really has.
Yeah.
And we'll talk more about that later.
We could just talk forever. You just have to shut us up.
No, I love it. I mean, this is really, we're just getting into the nitty gritty of it right away, because this is what people want to know. We have a few people already commenting, hanging out with us. So we love it. Thank you guys for hanging out with us. If you have any questions that you just want to know right now as we're talking, go ahead and put it in the comment section and we could get that answered for you right away. But when we look at, some of these medications, and when someone is taking it, what exactly is it doing? How is it, affecting them to, assist them with this weight loss journey?
So I don't want to get too Bill Nye the Science Guy because I'm not as good as him. But just to let you know, okay, so the first drug that came out was Ozempic. Okay, that came out in 2017, and it was only for diabetics. The generic for Ozempic is called semaglutide. So as diabetics started to take it, there were more studies. All of a sudden, people were losing massive amounts of weight, not just improving their A1C like Lynn was talking about. So, of course, the pharmaceutical company was like, oh, wait a minute. I think I see an opportunity here. Yeah. And so they rebranded, got approved for the first weight loss drug to be approved by the FDA in 8 years in 2021 as Wegovy. But Ozempic and Wegovy are the exact same medication. There is no difference. The only difference between the two is that you can actually go to a higher dose of semaglutide when you're on Wegovy for weight loss than you can when you're being prescribed it for diabetes, if that makes sense.
So is the progression slower for a diabetic?
Typically, yeah. So like with a diabetic, when you're prescribing it to someone with diabetes, you're really wanting to improve their A1C. So they may not be very aggressive in terms of increasing your dose. And it really depends on your practitioner, your labs, your health, all of that. But they're really looking at your labs. Like, are you doing better? Is your A1C getting better? Then why do we need to be aggressive with the dosing?
Yeah, they've been going really slowly.
Right. Which is not bad.
Okay.
I mean, it doesn't take 3 months to gain weight, and it should not take 3 months to lose weight. That's the first thing that we always tell our patients is that please don't come here looking for a quick fix, because when we want patients to lose weight, we want them to lose it and keep it off.
Yeah.
If you keep, which we've all done this yo-yo, that's not good for you or your metabolism.
And I think my weight loss has been very slow
and steady.
And the thing is, I'm not one of those people that get on the scales all the time. So I never see a number. I just know by the feel or my activity level or whatever. But I'll just tell you my story real quick.
Yeah, tell me.
So when I first started, they said there's this new drug out, and we want you to try it to get your A1C down. They gave me the thing, but you had to
Quick question, because we keep saying A1C for a lot of us who don't know. What is that? Yeah.
Hemoglobin A1C is basically a blood test that shows you how well your blood sugars have been stabilized over the last 3 months. This is not an exact formula, but in general, if you just want to do some quick math, you can multiply it by 20. Is it 20? I think it is. So let's say Lynn's hemoglobin A1C was 11. So 11 times 20.
Oh, Lord.
Why did I do that to myself, y'all? Is it 220?
Yeah, I think
okay. So that means that her sugars were running above 200 on average for the past 3 months. When you knock it down to 7 times 20 is 140. That's way better. So when we say A1C, we're talking about an average blood sugar over a 3-month period.
Perfect. Okay, thank you. Lynn, back to the story.
Anyway, they gave me the thing, and I had to inject myself, and I was deathly afraid of needles.
Right.
And I said, I don't think this is going to work. And she said, well, there's this new medication called Trulicity, and it's a self-injecting pen. Do you think you can do that? I didn't do it myself for the first month.
Oh, really?
I was doing a radio show with Bisky Duncan.
Oh.
And every Friday,
shout out Bisky Duncan.
Every Friday she would
Inject you?
Yeah.
Oh, what a good friend.
And the thing about it was it hurt so little that I was like, oh, I could do this.
Exactly, yeah.
I could do this.
Right.
So I started doing it myself. And when I went back to the doctor said, oh, you're doing great. You've lost 23 pounds. And I'm going, huh? How?
Right. Because you weren't trying.
I haven't done anything. Like, I've been eating the same, I think.
Right.
You know? And she said, oh, well, this medication can make you lose weight also. And I was like, oh,
good to know. Right, yeah.
Yeah, so that's my story about how I started. I didn't even know, and I was just shocked.
Yeah.
But now, as we get more into the conversation, we can talk more about some things that maybe you need to know when you're on these medications.
Absolutely, yes.
Because those burps are killer.
I know.
Okay, well, we get to that later.
I didn't even know about that part. Okay.
Ready.
I didn't even know about that one. So, okay, we got some things to learn also for the people who are on these medications. And so, okay.
We have did you see that we have a comment?
Oh, okay.
So, said, I need to make an appointment with Dr. Jaya. I need to get back to my pre-COVID weight. I gained a lot and have long COVID symptoms like no energy.
Oh, God.
Could this help?
Well, long COVID is very difficult, and I'm sorry that you're going through that. But yeah, so there's definitely multiple options that we have at our clinic, shedit.com, Shed It on Shed Road. The phone number is 318-746-3880. My boss is going to be very happy with me
that you got that in.
That I got that in. But yes, Alana, you could come in. We can do an evaluation. We have multiple options to choose from, not necessarily just the injectable medications, because one of the side effects of the semaglutide or the tirzepatide, which is the generic for Mounjaro, can be fatigue. Right, so if you have long COVID, we don't necessarily want to make you more tired. We may have an oral option actually called Qsymia we could discuss that would give you a little boost, help you lose weight, but not necessarily drain you. So just come talk to us. I'm sure we can find something that works for you.
That's incredible.
Yeah.
Now, and I heard, because my radio co-host, Jay Michaels, is one of your clients.
Yes, he is. Yes, we love Jay.
Now,
but he won't drink his water. Oh, can I say that? I think he said it. Ooh.
It's more than just the weight loss drugs, though, right? Because do you guys give vitamins and different
We do. So we have the generic for semaglutide and tirzepatide available. And I can explain what I mean by generic later if anybody needs to know, because I would like to be accurate with my medical information. But we do also carry what we call a fat blaster shot, and it has actually vitamin B6 in it, which is pyridoxine, calcium acetate. We also carry B12. And then we have these amino acids that help you flush out fat if you drink enough water. Water is the number one weight loss tip I can ever give everyone. Water. Unless you're on dialysis. Let's talk.
I bet Brittany, as a journalist, has some questions.
Oh, I bet she does, yes.
I'm soaking in all the information. Interesting enough, I know a lot of people were impacted after the pandemic with weight loss. For sure, I was one of them as well. But, I've never been, diagnosed diabetic. So if someone, you've kind of already touched on it a little bit, but just someone looking who isn't diabetic would like to use these medications, can they? And I guess that's where it reached, headlines as well, because a lot of people, maybe more famous people as well, were like using it.
Celebrities like us.
So, can you tell us a little bit about that and how it affects, those individuals?
Yeah, so that's a great question. I'm really glad that you asked that, because I do think that the first time most people ever heard of Ozempic was in the framework of, so many people are using it for weight loss that the people who really need it with diabetes can't get it, and that's really all that they heard about it. So I do think that reporting, obviously, what's going on in the country is important, but there's so many more questions that if someone were to come to me with that sentence that I would ask and answer. The first thing to notice is that they became famous when celebrities like Lynn and I, but also like if you've heard of Kim Kardashian or Elon Musk, I think that's how they made headlines, because they started using it for weight loss and either they said it themselves or someone found out. So as soon as that happened, of course it's like, oh, well, Hollywood's stealing the drugs from the rest of us kind of thing. So there's a couple important points I'd like to make quickly about that. The first is that right now, Wegovy is the weight loss drug. So Brittany, like if you went to your doctor and you asked for this prescription to be prescribed it for weight loss, it would be Wegovy. So it wouldn't even be Ozempic. It wouldn't be the diabetic one. And again, there is no difference. It's just the marketing. The second thing that I feel like people don't realize is that this is a very expensive medicine. So just ask yourself, how many people do you know? How many people do I personally know? And the answer is 0. That went to the pharmacy with $2,000 cash ready to buy that medicine and they couldn't get it. I don't know very many people that would be able to go and shell out $2,000 a month for a medicine that their insurance would not cover because they weren't diabetic.
Right.
So the question it actually is, because I have friends who are pharmacists, is do pharmacists order enough of it when it is available? Because why would you keep something on the shelves that you're not going to sell? I feel like that was hugely underreported, that pharmacists weren't even ordering it because they were losing money keeping it in stock, and nobody was buying it because it's very expensive.
Yeah, and it has to be refrigerated and all this kind of stuff.
Yeah, exactly.
It can't just sit on the shelf.
It can't just sit on the shelves, and it has a shelf life. In general, I do think that there is a huge crack in the healthcare system for access to medications. But I don't necessarily feel that it's the fault of people using the medications. I think it's the healthcare system, I think it's insurance coverage, and I think it's manufacturers not compensating for a very foreseeable possibility by producing enough medications before announcing that they have it.
Yeah, and then
well, it seems like you.
Seems like I do, yeah.
You know your thing, girl. When we talk about supply and demand as well, you mentioned something about generic options. So how does that work? Are there other options here locally? And then Lynn, I know you talked a little bit about your personal experience with the price of it and seeing that over time. So maybe you can touch on that a little bit after as well.
So what I want to say firstly is y'all pay attention. Because I had no idea that this was possible.
Yeah.
Our insurance here at the station does cover it because I'm type 2 diabetes. But when I saw the cash price of what it would be on the little form, it was $1,227.
And that's lower than I've heard.
If I would have had to pay for it. So that's crazy.
It's crazy.
So tell them about this generic formula.
So the best comparison that I can make, and by the way, if you do want to know if your insurance covers it, we do have a form at our clinic, shedit.com, where you can actually, we have the questions listed out that you can call and ask your insurance company to see if it's covered. But in general, unless your employer is opting in to cover that medicine, then insurance won't do it on its own. So shout out to KTAL. That's awesome.
Crazy.
So, kind of like, I don't know if you remember when Lexapro came out, and it was a very expensive medication, but everyone wanted it because it improved depression in a short span of time. But it was very expensive because it was brand new. And then Walmart and some of these other chains came out with basically a generic called Celexa, where there's like one configuration of one molecule that's different, but ultimately for most people, it would have the same effect.
So let's just, in the plain people
talk, yeah.
It doesn't change how it works, right?
Exactly. So in plain people talk, what we have at the clinic is a generic form of the semaglutide and the tirzepatide. How it's different is that the pharmacy that we get it from actually compounds it with B6 and B12 vitamins. So technically it is a different drug. But as far as what you care about, whether it works, it works.
That's incredible.
And so we're able to offer it to patients at a third of the price because the pharmacy is able to give us that price, and then we can pass on the savings to our patients. And also our whole modus operandi is that I didn't know that I knew what MO stood for until I just said it out loud. But our whole vibe at the clinic is that when you come to us and you're paying $5.99 a month, which is a third of the price, but still a good chunk of change. You're getting a month's worth of the medication, but you're also getting a doctor visit with either me or our PA, Michelle Doolittle. You're getting a body scan so that you can see your changes from the inside out and not just focus a number on a scale. And you're also getting I am on it, our PA is on it, our receptionist has taken it before. So we have firsthand experienced the side effects, what works, what doesn't work, and we pass all that knowledge on to you. And so we kind of like walk the path with you, and you can get this medication.
So your concentration is to help people lose weight.
Yeah.
So like if I go to my doctor, she's just concentrating on
your
my
overall
diabetes, right?
Yeah, right.
So that the weight loss, that's just that's good too.
Right.
But they're not really focused on that part. Whereas you guys,
that's all we're talking about.
Right.
I mean, there's a lot that goes into it. It truly is mind, body, and spirit. But like your doctor, I used to be that kind of doctor. And so I know exactly how long you have to see a patient and everything you're supposed to cover. So it really does make a difference when you can go see a doctor and only focus on how do I get well, how do I lose weight, how do I troubleshoot, which is, unfortunately, your primary doctors probably don't have a lot of time to do.
Right.
Not that they don't want to, but it's just, impossible with the time constraints.
Right.
So, yeah.
And we actually have a question here asking what's the name of the generic. Funny enough. Similar question we asked.
Yeah, so the generic for Mounjaro is called tirzepatide, and the generic for Wegovy or Ozempic is called semaglutide. So those are the two major players. Trulicity is a dulaglutide. Trulicity is also a player.
That's old now, right?
Trulicity is old news, girl. No. No, I have a family member on Trulicity, and he's lost.
Okay.
He's doing fantastic. And also, I don't know if people know this, the amazing thing about these drugs for the people who are safely screened to take them is that it's reducing your risk of ever being on dialysis. It's reducing your risk of heart attack, stroke, vascular disease.
Wonderful.
It's actually making you healthier from the inside out, and the weight loss is truly a side effect. It's making your body work better.
Benefits, a beneficial side effect.
A beneficial side effect for once, right?
Okay, so another question I had, because this was another, like you said, people kind of read the headlines. And so we saw this in the headlines about someone say they stopped taking it and they kind of gain more weight after the fact. Is that, we talk about a good side effect. Is that the negative side effect of taking something like that?
Yeah, because the truth is you can take this medication and change nothing about your lifestyle, and you will still lose weight. But if you do that, once you stop taking the medication and you've changed nothing, you will gain all that weight back and then some. Because let's say I started off at, like 221, and I'm down to 180 right now. At 180, I am hungrier than I have ever been, even taking the medication, because my body wants to get back to that set point that it has been at for a very long time. So when anybody loses weight, with or without medication, your hunger hormones actually do kick in more. But it's just like, let's say you're overweight, and because of your overweight or genetic predisposition, you have high blood pressure, okay? So you take lisinopril for a year to keep your blood pressure down. But during that time, you start eating a low sodium diet, you start exercising more, you're a bit about your water, your sleep, your stress level. Then if you wean down the lisinopril, chances are you could either take a lower dose or get completely off. So it's just like any medication. Some people will have to stay on it for the rest of their lives. And when doctors prescribe that, they need to be honest about that. And some people will be able to make lifestyle changes to the point where they could either take a reduced dose or get completely off. But the truth is, you're just not going to know that until it happens. I mean, we can kind of make a guess based on your labs and your health history. But yes, rebound weight gain, absolutely true. That is not a dramatic headline. It's true. Yeah.
Speak to that for a second, just in the fact that I still am not a good girl all the time.
Right.
Okay. But the medication will let you know if you're doing the wrong thing.
That's true too.
It will let you know, so that don't do that again. You have to learn that when it tells you you're full, you need to stop.
That's right.
That's another thing. That's one thing, is I was always a clean your plate. Not anymore. Can you tell them a little bit? I don't want to get into the graphic details, but it will let you know, and it will train
way
you,
or another.
It will train you to not do that again. And another thing I've noticed is I used to love chips and dip, like onion dip, stuff like that.
Yeah.
And now it's just not appealing to me. The only thing I can really snack on maybe trail mix or pretzels.
Yeah.
It just is certain things. Like, so it changes.
It's got to be like more hearty, like the texture matters now.
Pizza. I used to love to have pizza every weekend, and now it's just like
popping pizza
every once in a while.
Every once in a while, yeah.
It just doesn't. Yeah.
Doesn't appeal to you.
Yeah.
Yeah. I mean, so what's actually happening? So, okay. Let me think what I want to say.
How are you going to say this, doctor?
Yeah. I'm trying not to just like be crass like I would if we were just sitting around talking.
Yeah.
Let's sound professional, Dr. Jaya. So, semaglutide is a GLP-1 agonist, glucagon-like peptide 1. Mounjaro is GLP and GIP. All you need to know is that it's acting on certain receptors that slow down how quickly food is going through your system.
I've noticed that too. Yeah. Like, I didn't poop as often.
Let's just say poop. Can we just say it?
I didn't. And I was like, what? Is there something wrong? Is something blocked?
I mean, you can... That's actually a very real concern. Like, if you don't drink enough water, take the fiber, take the medication as prescribed, the first thing I tell all my patients is, if you're not going to drink the water and take the fiber, make sure you poop every day, just go on somewhere else, because this medication is not for you. You have to do it. But it's actually slowing down how quickly your stomach empties food. And that's in turn what's stabilizing the insulin levels, which improves your A1C and your sugar levels and all of that. But the side effects, yeah. If you're prone to reflux, that's definitely going to get worse. If you're prone to constipation, that's definitely going to get worse. There are workarounds. There are ways to troubleshoot that, but that's why we make sure everyone's good about their water and their fiber intake before we even start, because otherwise you really could end up in the hospital and have like a bowel obstruction because you're dehydrated and you didn't drink enough water, and that's a real concern.
See, I didn't know that. I just discovered on my own that I would have these horrible burps sometimes. And I discovered on my own that if I drank more water, I didn't have those.
So you need our cheat sheet where we have it all written down.
Because, I mean, and no fault to my doctor, but like you explained,
exactly.
They don't have time. And so nobody said, you're taking this medication, you need to make sure you drink a lot of water.
Right.
I didn't know. I just had to figure it out.
Yeah. I'm glad you figured it out.
And that's where I guess, Shed It is different, is they consult you one-on-one and give you that cheat sheet and all those details of what you need to know, the ins and outs, all those little tricks that unfortunately Lynn had to learn the hard way.
But she learned. She's a smart cookie.
Yeah. I came in this newsroom today, people, and I said I ordered apple bites from Wendy's with my meal.
Oh, nice.
My little chicken sandwich.
Yeah.
And they gave me a large French fry. Anybody want some large French fries?
Look at you.
I don't even want to eat them. The apple
Yeah.
bite's just more appealing right now.
And it's having that almost like that self-control too. You learn that over time, and it's hard to say no to some foods that you just love.
Exactly.
Oh.
I'm curious about this online question.
Yes, I know.
I was trying to get to that.
She kind of mentioned it, but...
Okay, I was going to let you go ahead and... so we asked you guys to send us in your questions throughout the week as we were getting ready and gearing up for this live stream. So I'm going to go ahead and let Lynn ask one of the viewer questions that we have here. You got it pulled up, Lynn? And we also have a few others here on our Facebook comment section, so we'll get to those too. And if you guys have more, just drop them in.
Cheat. So, Dr. Jaya, what lab work is required to take this?
That is a good question. Okay, so in general, especially if you're with your primary care provider, you should be checking like your kidney function, your liver function, and then there are certain blood tests that test the health of your pancreas and gallbladder. Because I think it's even up to 4% of people can get acute pancreatitis, which is inflammation of your pancreas with this medicine, and the A1C, like we talked about, and also a fasting glucose. So you want to have all those labs ready before you start, and then check them, I would say, at least every 6 months, unless you have a symptom or a problem, to check them more frequently. But those would be the basic ones, yeah.
You want to do one more?
Yeah.
No, go ahead.
Sorry. I thought you meant one more like the one we have here, because it actually piggybacks a little off that, talking about how often should you get that blood work performed, that A1C check, while on the medication.
Yeah, I think every 6 months is actually fine. Now, if you have someone that has an A1C of 11.8 and you want to really see like, well, that was pretty high. Maybe we should check sooner than every 3 months, but no more frequently than every 3 months, which would be 4 times a year. Definitely twice a year for sure, because you want a baseline and then you want to monitor while you're on the medication.
And Lynn, I think this question is more for you because it's a personal experience. You've been on it. You can tell us as well. Do you crave healthier foods? That's one of the questions here in our Facebook comments. I think, Jaya, you could probably answer too if you like.
Sure. Just for personal experience, no. I crave safer foods.
Safer. That's such a good way of putting it.
That's what I crave.
Have you had crawfish yet on Manjaro?
No, I don't like crawfish.
Oh, okay. I've had a lot of people tell me they went to a crawfish boil and they're like, oh no, we can't do the crawfish on this medicine. So that's why I was curious.
It just changes what you want to eat. And first of all, it changes the way you eat. I don't know if this is a good thing. I hate to say it in front of the doctor, but like sometimes I only eat like once a day, especially on the weekend, just because after that meal,
I know.
I'm really not so much hungry before the meal, but I know that I got to eat something. So I eat something and I'm good.
Yeah.
Till the next day.
I'll take my doctor hat off and my regular person hat on, because when I started it, I remember one day I had seen patients. I was finally done at like 4 or 5 p.m. and I realized I hadn't eaten all day.
Yeah.
And I was so excited because I was like, I never miss a meal. I can't believe that me, who's always thinking about my next meal, like forgot to eat, because I was always jealous of my friends who were like, oh, so busy, I forgot to eat. I'm like, shut up. And but doctor hat on, you should definitely eat enough small frequent meals. I mean, if once a day is fine, I just don't want people going like into starvation or under 1,000, 1,200 calories.
Oh no, Miss Lynn ain't never gonna make it to starvation. I don't think that's gonna be possible. But maybe can I say something that I think is the thing about it is, I don't ever see myself being super skinny, but I just really want to be as healthy as I can be at whatever size I am.
Exactly. I love that.
That kind of goes back into what you were saying about all these people are using this medication for weight loss and nobody else can get it. Well, if it's going to make them healthier, you know?
That's also what I thought was like, let's say, what percent of the population lives with the Kardashians or is in Las Calabasas? I can't believe I know that too. But, for the most part, people who are taking this off label or, who aren't diabetic are doing it because they want to be healthier. And I mean, I've been on it since late July or early August, and the ways it's changed my life are unreal.
And one more thing, and this is super personal, but I don't care because I'm just one of those kind of people that puts everything out there. But my food addiction issue has always been emotional eating, and that hasn't changed.
Right.
I still think about, I want to comfort myself with some food, but a lot of times what happens is I like, oh, I want to comfort myself with food, but nothing sounds good.
Right,
you
right,
know?
Yeah.
So, in all honesty, and I was doing therapy before, and I think I will seek another therapist because I need to get to that underlying issue of emotion. So, it will not change that. If you're an emotional eater, you probably won't eat because you won't feel like eating, but you'll still think about it. You'll still think about, I want to eat something, but what am I going to eat? And then if there's nothing you want to eat, you're just not going to eat. Or you'll come up with something in your head that sounds good and you'll eat it. If
y'all don't take anything else away from this entire live stream, the last 2 minutes was it. If everyone knew that, I have goosebumps. That is the most important thing.
Yeah.
It's really good.
And it's just for me having the realization that I have to be the change, that this is helping, but I have to be cognizant of what it's making me do and try to continue to do that.
That's right.
So
that's right.
Honestly, thank you both so much, Lynn, for putting your heart out there, like shutting down the barriers and getting real with the people out here, and Dr. McSharma for giving us your expertise and really getting down to the nitty-gritty of what we've all been thinking, wondering about this whole weight loss medication topic. I feel so much more educated, and I hope you guys do as well. Thank you all for those of you guys who sent in your questions. Last kind of thoughts. Do you guys have anything else maybe you want to add in regards to this topic that maybe you've seen in the headlines, you've seen people talk about, you still want to address, or any more personal experiences you want to share, Lynn? I know like you kind of talked a little bit about just the minor small things that you've seen a difference. It's not about the number on the scale, but more about how you feel and how you're able to, you know, do things different on a day-to-day basis.
Everybody watching, don't worry about what other people think. Some people probably look at me and be like, well, I can't tell she's lost nothing. Well, you know what? I feel better. I feel good.
Exactly.
So I don't really care, you know, like what anybody thinks. Stuff like this, you do it for yourself, you know? And that's the way you got to look at it. So like she said, it's not all going to come off immediately. I still got plenty of ways to go, but I feel better, and I feel like it could be a life changer for a lot of people.
It will. I think the main thing that it did for me was, ever since being an adult, I guess, I have always thought about, am I too fat? Am I too fat? I mean, I feel like this kind of self-assessment is constantly going, especially for women. And what this medication did for me was kind of take that off my plate. Like, I stopped worrying about, am I going to lose the weight? I started planning other things with my brain, like, what am I going to do when I lose the weight? Yeah. So my entire framework shifted. And also, just like you said, because I'm doing the work with therapy, hypnotherapy, working out, you have to treat the source of the trauma before you can get rid of the results of the trauma.
And I'll tell you just one little thing, because we talked about this earlier before we started this. And it's so simple, but this will give you guys an idea of just the little ways that it might change the way you look at yourself. I was always, when I did my hair, I always had to have some curls. I always had to have some curls. I needed to have big hair because my face is so big and fat, basically. In the last 2 or 3 months, I've worn my hair straight, and it's not bothered me. And I can say, like, oh, because your face looks thinner, so it looks okay now. It looks okay straight.
Right.
It's just little things like that can, you know.
So little, but so big, because I used to not be able to even, like, go into a store if I saw my reflection in the door, and then I'd just be depressed while I was shopping. So it's like, they seem like little things, but they're really an entire way of living. So just thank y'all for letting me be on. I'm glad to come back if you'll have me. And everyone go to shedit.com.
We will definitely be having you back for something else, expertise and all things. So I know we can find another way to bring you back here. Thank you guys.
Experience with the other thing, but
yeah, right, well, hopefully one day we can talk about that too.
More to come on that. No, thank you guys again so much. This has been amazing. If you guys would like to see more details on all the things that Dr. McSharma had to say about these weight loss medications and how her business Shedit is helping out the community in their weight loss journey, you can head on over to ktalnews.com for more details. Also, download the KTAL News Now app so that you guys don't miss a beat. You guys can receive push notifications there, see us every time we go live, and yeah, just get ready for our next live stream, because that is coming up soon. All right, thank you all again for tuning in and hanging out with us. We really appreciate it. We'll see you next time. Bye.